Hello, social media family. My name is Dr. Rosemond Abuaji, and this series is going to be talking about pregnancy scans. Just generally, when a woman is pregnant, we'll be evaluating her with ultrasound scans. We are checking out the baby, making sure the baby is developing well. We are looking out for complications that can affect the baby or the mother or both of them. And normally would do 2 or 3 scans in a pregnancy. The first trimester, that's the first 3 months. The second 3 months, that's from 4 to 6 months. And then the last 3 months, if there is a possibility of any complication. We are going to go through all the 3 trimesters, and for each one of them, I'm going to tell you the reasons why we perform ultrasound scans. A lot of the time, the indication for scans in pregnancy can be either routine, which I have mentioned before, the first trimester, the second trimester, and the third trimester, just so that we monitor the progress of the pregnancy. But other times, the pregnancy has complications, and because of that, you need to monitor with ultrasound a bit more frequently to be sure that things are going well. Examples of reasons why you may need to scan more than 2 or 3 times in your pregnancy include if it is a multiple gestation, you are carrying twins or triplets and rarely quintuplets or more babies than we normally would see. If the mother has maternal conditions like hypertension or diabetes, if we suspect that the baby has any form of congenital abnormalities, if there are other pathology or problems that the mother has like ovarian cysts, if they have fibroids, or any other problem in the abdomen or pelvis that may affect the baby. Sometimes there's a problem with the placentation. The placenta is low lying, and when that is the case, we need to keep monitoring, because as the baby grows, the placenta may migrate upwards and it will not be a problem anymore. Sometimes when we are worried that your baby is too small or too big, we will need to be scanning more often to check on the growth of the baby. A few times the baby may be breached or presented in the transverse position rather than cephalic, which is when the head is down, and we need to monitor to know when the baby turns. It is important to note that a normal ultrasound scan does not guarantee you 100% that your baby is 100% normal. Sometimes there are abnormalities that are not picked up on ultrasound, either because you just cannot pick it on ultrasound, or because at the time the scanning was done, the baby's position did not permit the radiologist or sonographer to pick up those abnormalities. On that note, I'm going to tell you a little bit more about first trimester scans. So when you initially find out that you are pregnant, the very first 3 months of the pregnancy, you are likely to have a scan. And in this scan, one of the first things we'll do is to establish that really you are pregnant. And so we are looking for the gestational sac. Normally, we would find it in the uterine cavity or inside of your womb. A few times you do not find it in the womb and would have to look elsewhere. In that case, we are worried that you have an ectopic gestation. In the first trimester, your scan can be either transabdominal, where we scan from your lower abdomen, or transvaginal, where we put a probe through your private part. That one enables us to see more clearly, especially when it is very early gestation before 6 weeks. And so depending on the indication for the scan, you may have transvaginal scan or transabdominal scan, but commonly we will do a transabdominal scan for you. Other reasons for which we'll scan in the first trimester include to verify if the gestational sac is 1 or more. Sometimes, even if the gestational sac is 1, you may have more than 1 fetal pole. So you need to identify the fetal pole. That tells you that indeed there is a baby in there. It is important to know that there's a fetal pole because, one, there are some pregnancies that have a gestational sac, but they never develop a fetal pole, and you need to get rid of that pregnancy. Other times, the fetal pole is more than 1, and that is what confirms that it is a multiple gestation. The gestational sac is just 1, but you have more than 1 fetal pole inside, and those are the children or babies that turn out to be identical twins. After you have identified the fetal pole, You also need to look out for a heartbeat, and that is what confirms that the pregnancy is viable or that this baby is alive. Next, after you have confirmed that there is a heartbeat, then you calculate the gestational age and the expected date of delivery. The EDD, or expected date of delivery, that you get in your first trimester is the most accurate compared to what you can get in your second or third trimester, and that informs our decision in managing subsequently. If, for example, you go past your date, it is the EDD that will tell us that you are supposed to deliver on this date and you haven't delivered, and so we need to give you 1 week more and then decide what else to do for you. In the first trimester, some people have problems with their cervix, and so your radiologist or sonographer may need to evaluate your cervix to check whether it is too short or whether it is opening up, and then we can inform your doctor if you are at risk for a miscarriage. There are few abnormalities that are picked up in the first trimester. In your first trimester scan, certain chromosomal abnormalities may be picked up in the form of various signs, and so very early in the pregnancy, before 13 weeks, we may measure some parameters, and those will give us indications as to whether your baby is likely to be suffering from any form of chromosomal abnormalities. And so these are a few of the reasons why in your first trimester you will need to have a scan. Other times you may have complications such as pain or bleeding, and you also need to come in for us to determine, first of all, what is the reason for the bleeding, one, and two, if the pregnancy is still viable. Because when you are bleeding, the pregnancy may be viable, but it is also possible that you may have suffered a miscarriage, and the ultrasound scan will confirm the miscarriage, one. Two, it will tell us whether all the products have come out or whether you still have products in there that need to be taken out. And three, we may not have picked up an ectopic earlier, but once you have pain and you are bleeding and you come, we may be able to confirm at that time that indeed you have an ectopic gestation. Thank you very much. Watch out for the rest of the series to find out more about second and third trimester scans. God bless you.